Hello, this is Jason Arnold, and this is the discussion post for 655, the project management course. Today, I was just going to give a brief highlight of my opinions and begin the discussion based on the process of stakeholder analysis, and as well as how we felt about the role of the stakeholders within maybe an EHR project implementation or integration. As far as the article that we had to read, I think it was called, it was called Why in the Hell Do We Need EHR Records or EHRs? I thought it was an interesting article. I think the first thing that I thought about within the article was, I hate to say the negativity of maybe the clinicians and the other healthcare providers using the system, like the end users of the system, but it can show you how the morale of an actual system could combat, the readiness of the organization, or even, again, the morale of how they're going to utilize the system accordingly. I know as far as a lot of the things that they said in the article, some of the things, and I can highlight them here, were the first thing that I thought about was physicians are unsettled due to missing or insufficient and negative information about the EHR. Specifically, in this case, the Austrian EHR was the ELGA. And that's just, that's definitely a big one as far as, just being unsettled or not having enough thorough information about it, because sometimes too much information can kind of combat and blur the vision, which was another, category as far as those generalized statements that the, the examples kind of showed within this article. Some that were the most pressing were like the data privacy and data protection that's not being guaranteed. I mean, that's definitely going to be a big deal when you're dealing with, the calamity of like spyware and ransomware and malware, things of that nature that can kind of pretty much can dwarf organizations' proactiveness and assertiveness and just movement going forward because of those protection type of deals. Also, yeah, I had a little pause right there. So, yeah, as far as that, the data breaches and data protection not being guaranteed, that's definitely going to be something that's going to fragment an organization. Also, within that same, I guess, breath, will be like the unauthorized third party users. And that can be like if your information is sold off. Again, that's kind of a protection security risk. But like that information is like precious, precious information. So if it's sold to the highest bidder, that can be utilized for, again, ransomware and malware type of things like that, as well as just giving that vital information away. So I could definitely see how those two things would be an issue. Also, the workflows or the custom workflows that the healthcare workers and clinicians and nurses have, that definitely can be fragmented within a EHR implementation. If you're used to having specific like bedside manners, or you're used to a certain, like I said, a certain flow or a certain style or rhythm or method to your madness within a hospital, and that gets completely changed due to EHR implementation, that's going to be definitely a big issue as well, because it's going to throw off the efficiency and effectiveness of the organization, and it can kind of raise healthcare costs with, if you got duplicate data entries, or if you got people who are just really not progressing with the utilization of the EHR tool. That also, it kind of goes into a little of the sorry, I'm looking at it right now. That kind of goes also into the cost of it, as well, as far as, you know, I guess as far as the physicians are concerned. A lot right here it says a lot of the cost of the EHRs be shifted to the physicians, or it can be punitive with the physicians. So a lot of times, if they have like certain markers they want to meet, or if they have certain performance ratios that they want to meet, and if the clinicians aren't meeting those goals or those thresholds, those costs of that blame can kind of go on the physicians as well. So I can see how that can definitely be an issue as well. Lastly, as far as just the usability of it, again, kind of goes into efficiency of like the workflows, but like the additional workloads and loss of time, or even the usability of the EHRs being insufficient. I mean, if your hospital is not running efficiently, or even a private practice, because somebody's going to own that private practice, it's not, kind of clouded with like state funding or government funding, things of that nature. But specifically, or especially in a private practice, if you don't have an efficient workflow, or if you have, the usability not being at a heightened level, it's going to make your process, and it's going to make the healthcare and the overall experience of the patients. It's not going to be as good, because the people are going to be, or like I said, the healthcare providers are going to be paying attention more to the data entry, and looking down the computers, and not really understanding, what the problems that the patients may have. And it kind of goes into that whole scenario of, if a person's coming in, they have a broken arm. If a person's coming in, they have infertility issues. I think they said that in our business needs article. That information is vital, but it's not the same information. So you're going to make sure that the information that you're going to get is specific to that patient at that time, and it's not just generalized information that you're going to need for a blanket system of healthcare. So I know that was a little bit long-winded, but I think this article kind of shed light on the do's and don'ts of the system, and what could happen when you have too many negatives going against you in a system, especially a huge overhaul if it's in a hospital organization, like the Cerner EHR system implementation statewide for like the VAs or something like that, which is $1 billion enterprise. But if it's something like a private practice, that could kind of cause a private practice to shut down just because of cost, or it can cause the patients to suffer mostly. But I think overall, though, again, it did shed a lot of light on the issues, and I think, I know Dr. Rutledge kind of brought a huge point of how, like, if you are doing a stakeholder analysis and you're a project manager, sometimes you can have up to 30, 40, even 50 stakeholders, and they have different opinions, and they have different outlooks on the situation. They have different like parameters that they're concerned about, whether it's data entry, or if it's workflows, or if it's just transparency with the doctors, or if it's like leading to two-class medicine. Like, all those things are gonna be their vital points and talking points, and you want to make sure that everybody's voice is heard. So to kind of be that project manager over something like that is definitely a daunting task. So I just think that's very interesting, and it definitely helps me when it comes to the performance, or professional management of like an EHR system, or project management of an EHR system, things of that nature. And I definitely look forward to learning more. That's a little bit it for me. I know it's a little long-winded, but if welcome any open discussion, any questions, comments, criticisms, or concerns. Thank you so much. Have a blessed day.